Thank you very much, sir, for taking time out from your busy schedule.
It's my pleasure, ma'am. Last time I couldn't attend because I was out of station.
It is always a great pleasure for us to learn from your cases, sir, because it is filled with experience of so many years. Yes, sir, we can start your case now.
Yeah, namaste. It's my pleasure to present this case in front of you in this SODP. Today is Women's Day, and here you can see there are different ways in by which a girl, a lady appears in the life. You can feel her presence as sister. You can feel her warmth in the form of friend. You can feel her passion in the form of beloved. You can feel her dedication in the form of wife. You can feel her divinity in the form of mother. You can feel her blessings in the form of grandmother. Yet she is so tough too. She is so naughty even. She is charming and sharing, melodious. And in all those things, she sometimes suffers from various kinds of pains in her life. So when she enters in 13th year, menstrual cycle starts, and that is a true sign that she is a woman. So on this occasion, I am presenting a case of female Mrs. P, age 28 years, married since 5 years, complaint of irregular periods and diagnosed as PCOD. I selected this case on this particular occasion because nowadays the incidence of PCOD is increasing, is one thing. And second thing, that today we are celebrating World's Women's Day. So the basic pathology of PCOD is the male type of hormone, that is androgen, increases in this particular pathology, and that give rise to the worst complication is infertility. And it is said that when woman becomes infertile, that means she loses her feminism. So this is basic pathology of PCOD, where because of male type of hormones increase in the body becomes more masculine and feminism is lost. So I think this is the best occasion to present this type of case. So this patient was taking treatment from gynecologist, and then she got her menses regular with OC pills. You know, these are hormonal pills. But when these pills are stopped, again she gets delayed menses. That means it was only temporary relief. And you know all that with these types of pills, there will be only withdrawal bleeding, no true menses appear. So this is not the right way of treating PCOD. She may get menses delayed up to 6 or 7 months. She never used to get menses up to that time. And only after taking some hormonal pills, she used to get next menses. Her first menses start at 13th year, and since then, menses were irregular. Especially in 10th standard, there were no menses for 6 months. There is mild dysmenorrhea during menses. Flow used to stop on 5th day. There was leukorrhea, and that starts after menses. Leukorrhea remains for 6 to 7 days, white colored, offensive. And in her whole talk, she was talking in very childish voice. That was my observation. Other complaints? she gets migraine. And now I feel little happy over here that last time the subject of case presentation was migraine, which I couldn't attend or I couldn't present the case. So this case is having both the thing, PCOD plus migraine. So it was left-sided, throbbing over the eyebrow, neck pain at the same time. This was also started since the 10th class. Her irregular menses were since 8th or 9th standard, but it was worst in the 10th class. And this migraine also started in the 10th class. Pain remains for 1 to 2 days, and it used to appear every week. This is present frequency, that it is more that almost every week once she gets this migraine attack. Elements from sun rays, if she goes in sun rays, if she skips meal or loss of sleep, it used to start. It is associated with acidity, nausea, and sometimes vomiting. And at that time of headache, she doesn't like to talk, doesn't like light in the room, doesn't like sounds or even smells. Second complaint, allergy to dust. She has recurrent cold since childhood, but nowadays again frequency has increased. There is severe sneezing, watery nasal discharge for 1 to 2 hours, especially in the morning. Sometimes yellow mucus. Only twice she got bloody mucus. Otherwise, it was yellow only. And it starts from any strong odor, like perfume or smoke or fog or dust. So she consulted to ENT specialist. ENT specialist told her that there is left-sided deviated nasal septum and she requires surgery. But she doesn't want to undergo surgery. So for all these things, she came to me for homeopathic treatment. She had few more complaints, like she had impaired hearing, right eardrum was perforated, surgery was done. Hearing is less as compared to left side. Back pain, especially in the morning after waking up. Then hair fall with too much dandruff. And infertility, that she was married since 5 years but couldn't conceive. She changed doctor. She said that she was consulting and taking treatment from a gynecologist, but she discontinued that treatment just because staff of that hospital behaved rudely. And then she said at the last that nowadays there is decreased libido, and for that she went through even counseling sessions. In physical generals, appetite good, thirst very much less, hardly 1 liter per day. And she said, I forget to drink water. She likes sour things and sweets. Dislike not specific, sleep good, eliminations, urine and stool normal, sweating is less, it is almost negligible, she said. When we learn case-taking skills, in this coming workshop, we are going to learn in detail only about case-taking from Shekhar sir. And what sir has told that after taking all the problems, writing down, we should ask that which is the most bothering problem for the patient. So initially what I used to do is, I write down, because every time every patient doesn't come by appointment. Sometimes they walk directly into clinic and we can't say no this time. So this patient was like that only. So in this condition, what I do is I write down all the fact level symptoms first, and then I start my case taking after that. So I ask here, what's bothering you the most? Previously, I used to ask, when patient gives you number of complaints, 5, 6, 7, 8, I used to ask, out of all this, what does bother you? Or what's bothering you the most? It was working many a times, almost every time. But few times, even I can say in last week, I took a case. In this method only, I wrote down all the complaints, what she said, and then I asked, what's bothering you the most? And she said, the taunts that my mother-in-law makes. It was completely out of context and it was not related to any complaint she told previously. So what I learned from Shekhar sir's teaching is, our question should be as broad as possible, and we should be always ready to listen what we have not expected. So this was completely unexpected answer from the patient. And that I was able to accept because of sir's teaching, that I remove that word from my question nowadays. Out of all these, I don't ask. And what sir also told us, that our question should be in minimum words. So what bothers you the most? That's enough. And here in this case, she said periods and migraine. So again, she didn't give one choice. So the next question should be again open. Tell me about that. So again here, I am not directly indicating either irregular periods or not directly indicating towards migraine. Again, this has come from sir's teaching. This is improvement in my case taking after attending SWARA Gurukul. So thank you very much to Shekhar sir for this. And then case went ahead, that she said, we are trying for baby for last 3 years. Initially, they had planning for first 2 years, family planning, and then they started trying for baby. Taken many treatments, but no use. I get irritated, tense, and headache starts. So I take tablet Dolo and go to sleep, but there is no relief. So even Dolo tablet was not giving a relief. Nowadays, I don't feel fresh in morning. I decide many things, but I don't follow properly. I am moody. Sometimes I am very positive and sometimes I am very much irritable. So initially I understood that it is only 15 minutes time, so I can't give you the complete case discussion. I ask only important question that I am putting in front of you. So I asked, irritable? Yeah. She said, I want cleanliness. And my co-sister's kid make it a mess in rooms. I tried to tell them, but then that co-sister talks rudely to me. It hurts me. Now in this slide, you will find I have made some highlighting some words. Second time I got word rudely, that initially she told that the staff of the hospital behave rudely, so she stopped the treatment from that particular doctor. And here it was in her house that her co-sister talks rudely to her just because she gives some warning to the kids that not to make mess in the room. And when she said, it hurts me, she started weeping and she continued, I feel all alone. No one takes my side. I remain in my bedroom and avoid going out. When I go to any function, people Even my side relatives also keep asking me when I will have a child. It hurts me. So I avoid going to such functions, but sometimes no choice. Hurt means I'm very emotional. I take everything to the heart and keep weeping in my room. Keep thinking continuously over and over. My heart pains. So how it feels like? I'm all alone. No one is with me. People are very rude. I am among wrong people. I used to like my family when I was newly married, but now I don't like my family. I told my husband to live at another place, but he refused. So she also said that she has fear of being alone. I can't remain alone. I need someone with me. Then I feel relaxed. Again, she has fear of high places and accident. So I took these symptoms for repertorization. There are many other symptoms I could have taken, like mood changeable and so many others. But I feel with this totality and with the sensation understanding also, I came to the same remedy. I hope you all must have guessed it. Any guess, please?
You all can write it down in the chat box.
Okay, without wasting time, I will show you. This is repertorization chart and the remedy coming close to our pulsatilla, arsenic and naxomica, covering all these symptoms. And I selected pulsatilla for this patient. Last year, she got this first prescription, pulsatilla 200, as her symptoms were presenting at level 3 emotion. So potency 200 was selected and PL for 1 month. Then there was one follow-up in between, but I didn't repeat any dose. Again, 30th of March, she reported that menses haven't come and migraine is reduced. So I repeated one dose again. And then there was no follow-up in the month of May. In month of May, we got workshop and that was about subclass 1. In subclass 1, we learn about Ranunculaceae family, all other families from subclass 1, and the common theme of subclass 1 is confusion and withdrawal. So as pulsatilla is one of the remedy from subclass 1, I asked her in follow-up about that confusion, that which situations you find confusing. And she said, if I have to make choices between two things, then I get confused. If there are multiple things, then there is no problem. I can choose many among many, but can't if only two options are there. So I asked, what do you do then? And she said, I don't do anything. I just ask my mother or husband. Again, here we find withdrawal, a kind of avoidance. And then in the month of July, she reported that her pregnancy test is positive. She developed hyperemesis for 3 months, but as she was taking medicines from gynecologist, she didn't even strike that for vomitings during pregnancy, homeopathy can help. So after 3 months, she informed. And after that, again, she received pulsatilla in 200 potency, and she got relief from hyperemesis even. So this is her USG report of pregnancy test positive. So the 5 years, 3 years trials, which were not working with allopathic medicines, she could find pregnancy test positive just within 7 months. And latest news is just 8 days back, she delivered a female baby of 3.2 kg. Baby is completely healthy, and there was no any complaint for except that Caesar done for mother as well as the baby. Both are healthy, and she gave a phone call on 2nd March to tell this good news. So I was so happy. So I decided to present this case for you. Thank you very much. And I must say one thing here, that whatever teaching that we got in SWARA Gurukul workshop and even in SODPs, my success rate in treating many different female disorders has increased a lot. So thanks to Shekhar sir and SWARA team members. Thanks a lot.
Thank you so much, sir, for bringing this amazing case for the discussion today. And really, it has opened up a lot of possibilities for our younger generation homeopaths who are present today, and that will give them the confidence to take up such cases and treat them homeopathically. And as you rightly said, that the questioning pattern that you mentioned about, what sort of questioning pattern that has to be implemented during case taking is excellent learning from sir. And in each workshop, sir have been giving these guidelines to us. And this upcoming March workshop will be the epitome of case taking, because throughout 7 days, we will be dealing day in and day out with various kinds of techniques with sir's cases. There will be a lot of cases given to you, and with the paragraph, you have to form questions. And then later on, the original text where sir have ideally asked the questions, that will be shared with you. So I think that will be like, a crash course on case taking, a 7 days crash course on case taking, we can call it as. And many senior homeopaths are coming because the topic is such, even if you're senior by the years of practice, but still the case taking is a subject where how much your polishing you do, you will get even better and better in your field, and your skills will increase, enhance, and that will give you actual seniority in your locality.